All right, time right now is 9:35. Well, several things factor into preventing a stroke, including diet, exercise, smoking. There's so much that can contribute this. And here to tell us more about how you can reduce your risk for a stroke and even possibly more importantly, how to recognize symptoms of a stroke. She's from the University of St. Augustine for Health Science, Dr. Jenny DeGrotto. Good morning.
Hi, good morning.
Thanks for coming in this morning because, you know, this is a very timely topic with what just happened to Jerry Lee Lewis last week, even though he's on the older side, but then you've got Luke Perry.
Yes.
And now everyone is talking about strokes. So what class, what's the kind of person that is going to be susceptible to stroke?
Yeah, well, stroke is more susceptible with our older population. Really looking at older individuals, we kind of look at 65 and older, but really anybody can have a stroke at any time. It doesn't really discriminate when it comes to that.
The difference between a stroke and a heart attack, medically speaking. Break it down.
Great. So a stroke really occurs in the brain, and that's what we're looking at, is that the brain has had a lack of blood to a certain area, and so we have a lack of oxygen and glucose at that time, versus a heart attack is specifically located in the heart, and it's at cardiac tissue.
Okay, so since we're talking and possibly a lack of air, what could be the effects of that stroke on someone?
Yeah, so the effects can be widespread. You can have an impact with your thinking abilities, your cognition. It can be your motor. Most likely, it's usually motor and sensory issues that are occurring. You can have problems with speech, with vision, with perception. Really, almost every area of brain functioning can be impacted.
Now, seeing somebody who's possibly just before having a stroke, I've heard that jumbled communication.
Yes.
Or there's some other very clear signs. What are those?
Yeah, so we use the acronym FAST. When we're looking at that, we're looking at the face. What happens with a stroke is because it usually is going to occur on one side of the brain. So then that means one side of your body is going to be impacted. So you're looking for that asymmetry and one side of the body to be a little bit weaker of some sort. So when we look at the face, is there any facial droopage? Does it look the same? Is the eye drooping? Are the lips drooping? When we look at the arms, so A is for arms in the acronym FAST. Can ask them to raise their arms up. Do you notice that one side is going down a little bit more? And that would probably be the same side that you notice that the face is drooping. When we look at the S for speech, is it garbled? Are they able to communicate? They may not be able to communicate at all. That can be a definite symptom that there is no speech. It can be really garbled and just not make sense as well, or very slurred. You might have quite a bit of slurred speech. So those would be the things I'd be looking for speech. And then the T is for time, which is so important to get in as soon as possible. Depending on what kind of stroke it is, you can be administered certain types of medication and increase your ability to recover from that stroke. And so the sooner you can get in and be seen by medical professionals, the better your chance of recovery and getting care for that stroke.
So if you recognize any of those signs in yourself or see somebody else, obviously you're going to call 911.
Right.
But what can you do in the interim to maybe mitigate some of the damages?
Yeah, so really looking at if you do notice those signs and symptoms, I would make sure that if you are taking any other medication, make sure you have that medication so you can take it to the hospital, to the medical professionals. You want to make sure that you are able to tell what time your stroke occurred, because if it's a certain type of stroke, that time frame is so crucial and important. So while you're waiting, those would be key components that you want to be able to pass that information on to the medical professionals.
And what about what's the best thing that we can do to avoid having a stroke?
Yeah, you know, it goes back to living a healthy lifestyle. Like we say with so many different things, the leading causes of a stroke are obesity, high blood pressure, cholesterol, diabetes. There can be different types of medications that can increase those things and can be a contributing factor as well. And stress. We all have stress, so just being able to live that healthy lifestyle, having a well-balanced lifestyle, trying to decrease your stress, eat healthy, exercise are really the best ways to prevent it. All of us are, some of us are predisposed to this, and so again, kind of trying to come at it from an aspect of prevention is your best key.
So when predisposed, you're saying because you have it in your family line?
Yeah, you may have, it may be due to genetics. If you have other family members who have had a stroke, you have a higher risk.
All right, fast. Face, arms, speech, time. Super appreciate you coming in and talking to us, because I'm never going to forget that.
Yeah.
And I'm going to pass it along. It's something we all need to know.
Great.
All right.
Thank you.